Toledo District, I've been completely surprised by the level of diversity and the peacefulness that exists between the people. We see Garifuna, Creole, Spanish, Mayan-speaking folks in clinics, in the villages, in PG.
I think I've been amazed at how rich people's lives seem here. In spite of not having, a lot of things or a lot of money, their lives are rich with community and with family.
The villages are spread out. It's one journey would take you an hour to reach out in the rural villages. So I think what happened is that the people that live in the rural communities don't get a lot of health care.
I've been amazed at how rural it is here, and how in many ways the communities are isolated when you get outside of Punta Gorda.
Hillside serves a large catchment area and fits a really intense need in the community in a way that a lot of other organizations do not.
Hillside provides clinical care both at our main clinic outside of Punta Gorda in Eldridgeville and also in the villages. What that mostly looks like in my experience so far is basic primary care and chronic disease management.
They're coming to get checkups, they're coming to get routine medications, they're coming to have someone listen to them. And I think primary care is sort of the interface between a person feeling unwell and then them receiving any kind of service that they might need.
The Toledo District has only primary care providers. There aren't any surgeons or specialists. So patients have to travel a long way, several hours, typically up to Belize City, which is a 6-hour bus ride, if they need any kind of specialty care.
Hillside is doing a lot more than when I started back in 2001. A lot more activities, home visits. Now we have the Rehab Program that's going on, which weren't happening before.
The Rehab Program the model is a community-based rehab model, and it's based on the World Health Organization. It's a World Health Organization model. We are providing outpatient care only 2 mornings a week, and those mornings can be pretty full. Home health generally will do three half days a week, and then on the mobiles, there's usually, once a month, rehab is on an overnight mobile, and then we do day mobiles at least once a week, sometimes twice a week. It continues to grow and develop, and continues to be a very busy program, but a great program that's really reaching a lot of people in need.
We don't charge for any of our services, so providing a free space to come get medication, to come have sort of a checkup, to talk to someone who might listen to issues that are happening in the home or in the community is something that we do well.
The clinic opened in the year 2000, and I started a year after, which is 2001. I started here at the clinic when we actually only had 1 truck.
Historically, it started as a very small operation. We had 5 to 6 students here, and we alternated a mobile or home clinic.
I had to take the 1 truck we had, and then I would go down to the creek, we get water in buckets, fill it up in a drum, bring it back to the clinic, and that's how the students would take the shower. I've watched the clinic grown from talking about vehicles, from 1 vehicle to we have 5 vehicles now. Staff has gone up to 19 people. Back in 2004, they drilled this well and installed all the equipment needed for us to have water for the dorm and all the rest of the building. So now the students can have shower regularly. We're never out of water since then. So this is a blessing. Okay, right now we're looking at the main building on the compound, the BIS building. The first floor is the clinic. Second floor is office, and there's a storage space, and the third floor is for meeting. Every Friday the staff meets, and upstairs is where we use for a meeting space. Down here we have what we used to call education center. We used to use this building for presentation for the students, and now we run a PT program here at Hillside, and this building is used for doing all the PTs, seeing the PT patient that comes here. You're looking at Abid's house. I also mentioned that this house was built in remembrance of Abigail Brinkman, who passed away in a tragedy here in Belize as a student. Mr. Roger, the dad of the girl that passed away, turned something good out of the whole tragedy.
Thanks to the Abbey House, we have a capacity of 14 students per month, and we can now have mobiles and home clinic happening simultaneously. So 4 days a week, we have at least 5 students in the home clinic providing care to the citizens around Eldridgeville, in addition to at least 1 mobile unit, sometimes 2, going out into a village.
We have students who are rotating here for a month at a time, and generally they are the first contact for patients. I think that's another thing that we really try to focus on here is teaching future, clinical providers.
I've done a number of global health sort of work opportunities, and none of them have looked as team-based as this. I think it's a really unique model, and I think the students walk away with not only feeling empowered, not only a better understanding of global health, but really understanding what a team-based model looks like, and that's the direction we're moving in terms of better healthcare.
Day in the life of Hillside. It's an adventure each day.
Live in Belize, very hot, very humid, but it's very, very nice here. Everyone's really welcoming, really friendly.
I've never been to Belize before, never even Central America, so it's quite new to me.
You work hard throughout the week, and you get to relax when the day is over, but the first 2 weekends were I can honestly say 2 of the most amazing weekends I've ever had.
It's interesting how different Belize is just going 2 hours away. You've got beaches and then this rainforest land. It's been really fun to go on adventures.
We were on a private island, and we went fishing and we went snorkeling, and I've never experienced anything. I've never been snorkeling, never been deep sea fishing, so it was a pretty cool weekend.
Abbey's house is a really, really nice place to live.
I was imagining dormitories, bunk beds, cramped conditions, but it's so good. You got huge communal living areas, you got your own bedrooms, you got hot water.
I really like the sociable environment, so we all kind of cook together, we all kind of do activities together.
It's just an amazing experience being able to live with other people, experience their thought process on different things.
Couldn't ask for more, really, and it's clean as well. I think it's probably the best elective experience I could have asked for. When I was thinking about which elective to go for, I wanted to go somewhere where I could have full responsibility, actually do things, because normally in the hospitals, all you do is just follow people on ward rounds, follow people in clinics, you don't actually do anything.
Yeah, you're pretty much chucked in the deep end, so to say. But you're very well kind of looked after, and if you're not comfortable with that, then that's absolutely fine. The preceptors really do take care of you.
But here you get a chance to just practice your own medicine under supervision of a preceptor, and it's just a responsibility. I think it's fantastic.
It's been fun to have somebody that really listens to me and says, yeah, I think if you think that this is what they need, let's go for it, and sort of trusts me to be doing the right thing. It's nice to have that independence a little bit before I graduate in 3 months.
Yeah, you get to do everything. So you take histories, examine patients, prescribe, which is something completely new to me as well.
I think this experience has helped me rely less on the cushy things that we have at home, like the availability of labs or a CAT scan. And it really pushes you to hone in on your physical exam skills and your history. And history is a little difficult here too because of the language barriers, especially on mobile.
So for mobiles, you just go on, leave in the morning, travel about 1 hour, 2 hours maybe, go to the clinic. And it depends where you go. Some villages are better off than others.
Different mobiles are set up a little differently. So some mobiles you're in a hut and you've got chairs and that's about it. And then some have, proper examination table.
In mobile clinics, the medications are kind of the limiting factor.
You have to kind of prepare for the unexpected. You don't know what you're going to see. it's not like people have appointments. So we bring every medicine that we can think of, but not all of them. So it's really interesting trying to adapt how you treat people based on what you have available.
You really just have to think outside the box. And you have to do that in the States, but you just, when you hear in Belize, it's just a different factor comes in with the whole lack of resources. So you have to kind of include that when you're thinking about all this stuff. And it can be challenging, but at the same time, it's making you a better clinician.
Everyone knows about Hillside around this area. If you mention like Hillside to anyone, they'll be like, oh yeah, yeah.
Everywhere you go, Hillside has a great reputation within PG and even other surrounding villages.
Everyone really appreciates the work that we do. They're even, very willing to give you lifts, for example, and a lot of them come up to you and kind of thank you.
It's so rewarding to know how much the people appreciate you here.
The access to healthcare that Hillside provides is very important for the people living in Punta Gorda.
We've had several people in the community tell us what an impact Hillside has had.
When you come here and you have the opportunity to talk to the people in the community and you understand how important Hillside is, then it just makes you feel so much, it makes you feel so good to know that you're here and you're making a difference in these people's lives. I can leave Belize knowing that I've helped change someone's life. It may be the smallest thing, but I've done something to help change someone's life, and I think that's the most important part about it.
We hear again and again that the type of care, the privacy, the thoughtfulness, the intention, and the holistic look at health that Hillside provides is different than what's received elsewhere.
I am a patient from Hillside, and I was sick. I was having arthritis on my 2 knees. I was lying down here at my house all by myself. Melissa, she was the nurse at the time. She come along with the doctor. So they question me. I tell them, yes, I am here. I have 2 of my knees hurting me. I can't walk. I am lying down in my bed. So the doctor told me, okay, from today on, we will visit you. Melissa will come and visit you every week at a time, every week. Melissa come in the morning. She give me therapy. She make exercise, walk down, walk on the street. Then the sugar step in. When they come to me and check my sugar, my sugar was very high, 400. So they told me, don't worry, it will be going down. I have medication for the arthritis, medication for the sugar, medication for high blood pressure. The medication from Hillside, the therapy that I get, and my faith have me like this. It was like a miracle when I start to walk. One time I can't reach to the church. Now I could. Because people from Hillside helped me a lot. And I'm thankful for that.